Our last speaker for this panel is Grace Lubwama. She is the CEO of the YWCA in Kalamazoo. Unfortunately, she was unable to join us in person, but did prepare a recording that we will now share.
Hi, everyone. I apologize I'm not there with you, but I hope that all of you are well and safe. My name is Dr. Grace Lubwama. I'm the CEO of the YWCA Kalamazoo. I am excited to be part of this panel and really talk about things that are important to me personally. I'm going to be talking about our story here in my local community, Kalamazoo, how we have addressed maternal and infant health inequalities that exist in our own community. You know, when I came to Kalamazoo 8 years ago, as a public health expert, every time I go to a new community, I really want to find out, is this a community that I can raise my two boys? Is this a community that I can enjoy with my friends and my families and my children? So I moved from Los Angeles to Kalamazoo 8 years ago. And with my public health training, I have known and learned that infant mortality is a white glove test. So what I have done, and we know that infant mortality is also an indicator of how well a community is taking care of its most vulnerable citizens. And for our work and focus on equity, especially Black mothers and their infants. You know, being the CEO of the YWCA, our mission is about eliminating racism and empowering women. So there is a higher calling for everything that we do in our community to be intentional about race and gender equity. When you look at the infant mortality in your own community, it talks about the iceberg of what's happening in your own community. High infant mortality is considered a tip of an iceberg. So what that tells you, there are so many underlying issues that impact mothers and infants. And when you go in your local community and check out and really break out the data and examine what's going on around your infant mortality, you'll be surprised about the amazing things that you find. You'll be surprised how it's a really key indicator to a lot of social issues that are happening in your community. And as you want to develop local public health strategies, you know, using infant mortality as an indicator is very, very key. So in our own little tiny community in Kalamazoo in the Midwest of Michigan, you know, when we moved, I kind of looked at our community. We live in the Midwest, gotta edit that. We live in the Midwest of Michigan. It's a very small, beautiful town and has amazing things. One of the things that our community is very popular and known about is the Kalamazoo Promise. We are such a progressive community development concept whereby, you know, we have the ability, if we did this right, to have a real impact on the well-being of mothers and children in our own community. We have what they call the Kalamazoo Promise. This is an opportunity for every child that goes to and graduates from the Kalamazoo Public Schools has an opportunity to go anywhere in the state of Michigan, whether it's private, whether it's a community college, to go and obtain higher education without any cost. So we are very, very progressive. But one of the things that we did not think about when this was launched 10 years ago is the intentionality of using education as an intervention to reduce equity. So because we have such a gift in our community, really looking at our infant mortality was important. Our story in our own community, even if we're such a unique community, unfortunately, Black infants have been dying at a rate 4 times higher than the white infants for the last 20 years. This has been a story, even though our general infant mortality looks great, when you break our infant mortality by race, you'll be surprised to find that in our small community, for the last 20 years, Black infants have been dying at a higher rate compared to our white counterparts, based on the population that we have in our own community. What is so surprising, the disparities that exist in our community are even worse than some of the counties that are near us that have higher population of Black people. So when I found out as I moved to Kalamazoo that there was such a high disparity rate between Black babies and white babies, I knew there's something that we needed to do at a local level. And I knew that the best intervention will come from mobilizing the community. And we knew that if we address the infant mortality disparities, we are definitely going to be taking care of the mothers in our community and the children in our community. So we mobilized as a community. We started to ask us questions in our own community. What does infant mortality mean? What does being equitable mean in our community? How do we become a community that is addressing the root causes of systematic racism? And if we start by infant mortality, knowing the disparities, what that story told in our own community is when Black babies are born in our community, they did not have a chance to survive. So what that meant in our own community that, they will not be ready for kindergarten because remember, they started out worse when they were born. They will not be reading at third grade. They will not be graduating a high school. They will not be able to go to college. They will not be at any of the board meetings or boardrooms that we want them to be. So addressing infant mortality for us became a huge community solution. So we mobilized residents, we mobilized community partners, we mobilized government agencies, we mobilized funders and created what they call a Cradle Kalamazoo to End Infant Mortality together. So that initiative that, really we did not have a defined model, but all we knew is we had a goal. We had a broader vision that every Black baby, every child of color born in our community was going to survive. And because every child, every Black baby, every child of color, our commitment was every mother should survive as well. So addressing both maternal and infant health was vital to what we're doing in our own community. So we came up with a very interesting strategy. And again, really combining things that are evidence-based, combining things that have been effective in communities, and bringing those different elements in our own community to figure out how we could address the high Black infant mortality. So a couple of things that we did that were really at a local level. I talked about a community collaboration. So Cradle Kalamazoo was founded by the voices of residents. We did a lot of surveys in our own community. We went back and interviewed all the mothers, most of the mothers that had lost their babies in 2000, I think we started this in 2014. So we went back and interviewed mothers who had lost their babies. We wanted to hear their voices. We wanted to inform our local strategy on how we would do that. So after getting those voices, collecting those surveys, we then created a collaborative. Again, it included residents, it included community agencies, it included governments, it included the faith-based community, it included all the different partners. So we knew that no one agency would solve a problem. We knew that no one partner would solve the problem in our own community. So the other thing that we did, we started to do targeted community intervention. So we were not shy away to say, what's our target population? Who are the people that should be receiving services? What's our intentionality about dismantling systematic racism in our own community? So we started to think about what are the evidence-based practices that are out there that we can bring in our strategy and do that. So we started to identify those things that are evidence-based and brought them in our own community. And in the process, we are very, very intentional about community engagement and voice. For the communities that have been highly impacted by infant mortality, so that means our intentionality about engaging the Black population, which had the highest infant mortality, our intentionality about engaging women who had had previous birth outcomes, our intentionality about engaging, populations who are living in poverty, because we knew those were the three indicators of Black high infant mortality in our community. So the other part that we did, I said, really identifying our population at risk, so that our interventions had a really equitable lens in what we're doing. We didn't want to do something for everyone. We wanted to be intentional about addressing and targeting our population at risk. So as we identified those high level, what we did is we created a socio-ecological framework that included public policy. So we knew we had to do some work at a public policy level, some policies that needed to change. We wanted to make sure we did understand our own community context, especially as we address systematic racism, as we speak about systematic racism, as we address racial equity, racial inequalities that exist in our community. So we had to be okay with our own community context. We also looked at the social support systems. Do we have enough social support systems in our community as we kind of bombard the infant mortality issue that we have? Because we knew if we did address our infant mortality issue, then all the other social issues will be able to address. So we had to do an assessment. What are the social support systems? Where are the gaps that we can fill? What are the deficits that we have? Where have we not allocated enough resources to do that? Then the other thing that we did is really focus on individual health and behavior indicators. For us in Kalamazoo, safe sleep was important. So doing a lot of campaign around safe sleep, doing a lot of campaign in our community to help our community understand, what are the best practices? How can we increase access? We started to be intentional about the home visitation programs that we were having in our own community to ensure that we were reaching the population at risk. And as we integrated all those things, the social equity was the foundation of everything that we're doing. We wanted to make sure there was equitable distribution of resources to the population at risk, to our target populations, to the families that were most vulnerable. And we also wanted to be intentional as we combat the infant mortality issue. Are we looking at other social determinants of health? So we wanted to make sure that, definitely the economic stability, health care access, education, social and economic context within our community, neighborhood built environments. We wanted to make sure that the social determinants of health model elements were also vital to our broader strategies. So the overall goal of what we are doing, we are not there yet. We are continuing to do the work. But our overall goal is until every baby, especially Black babies, especially babies of color in our community, survive for their first year. So our goal is we are going to be intentional to touch every baby that is born in our community. And as we touch the babies, we know that we'll be touching the mothers. The end goal is to reduce the health disparities, to reduce the infant mortality disparities, to reduce the disparities that exist around mothers giving birth, especially mortality, especially for Black mothers in our community. So that's what we've been able to implement in our own community, really being grassroots, really being intentional. We are not defined by anything. We are defined by what our community needs. If our community says, hey, we gotta shift the roadmap, we gotta go this other way, we are committed to doing that because we know with community engagement, community voice, intentional strategies, we will be able to accomplish what we want. And like I said, the end goal is to ensure that every baby born, especially our babies of color, especially Black babies in our community. So what has really made us successful in our community, in our own intervention, is really listening to the community voice. And we have experts on our panel. We have people who have PhDs. We have epidemiologists. We have leaders of agencies. But what has made us very successful is pivoting to the voice and needs of the community. The community knows better. And what I mean by the community is really hearing from the mothers that have lost their babies, hearing from the residents of where we have our highest infant mortality, hearing from the community, the faith-based churches that are best in our community, in our Black community in Kalamazoo have been very, very vital. And we've continued to do surveys and doing better and pivoting, like I said, to ensure that the community drives our strategy. Even though they're evidence-based strategies, but listening, and being driven, the strategy being driven by the community has been made our work successful. We are still doing more work. We are not there yet, but we are moving in a good direction. I'll give one more example. You know, we started with a community-based agency, the YWCA, holding the work. We moved the work to the clinics, thinking that we can capture more women when they go to the clinics. Then the community came back to us and said, no, we want the foundation and the driver of the work to be best at the YWCA, an agency that understands racial justice, an agency that understands the empowerment of women model. So again, our solution has been listening to the community and driving the work from a local perspective based on the grassroots movement. Thank you.